in your mind rather than starting arbitrarily A to Z. No, the question asked about clinical feature. So you can just start with the clinical features. What are the basic symptoms and signs? And again, have one structure like nicotinic receptor stimulation, muscarinic receptor stimulation. And on that basis of the receptor involvement, the manifestations are like this. Can you imagine how the examiner would feel if you will be writing neuromuscular junction, autonomic ganglia, adrenal medulla, and the manifestation are this. Now coming to the muscarinic receptor, M1 to M5, CNS, heart, pupil, exocrine glands, and smooth muscle. And you can just highlight the points. You don't need to write also full sentence. It gives that extra edge over the other candidates who have wasted their time in writing 8 lines, 10 lines just to explain these things. Now you can also have another form of your answer in the field of muscarinic features, nicotinic features, CNS features, and you can remember having our age old practice of remembering the easy things: diarrhea, urination, meiosis, bronchoria, bronchospasm in some form of dumbbells, nicotinic features, CNS features. Now, then you can also divide the poisoning based on the type of poison, the symptoms and sign, based on whether it is like the carbamates or it is organophosphorus. So on that basis also you can divide the clinical presentation. Now, you can also a plethora of information like neurologic manifestations in the form of weakness, unconsciousness, cerebellar manifestation, neuropsychiatric symptoms, extrapyramidal findings, ocular findings, and other features. Again, just what I have told in the tabular format, you can also remember in the form of muscarinic overstimulation, nicotinic overstimulation, and again with certain forms of the mnemonics that would be easy to reproduce on your piece of paper in your theory. So that also you can write. Now, the symptom of sign again can be divided on the basis of time of manifestation: acute, delayed, late. And again, spectrum of delayed manifestation on the basis of time of onset of manifestation from the time of ingestion of that OP compound. So the way how you are producing on your piece of paper on the day of your theory exam, that also gives the confidence that yes, I will definitely get 80% at least from each question. So if somebody is writing in this fashion, anyway, he or she is saving lot of space, and on the paper, it looks little bit of neat and clean and also very much organized. So the examiner would be only looking at the headlines, how you have written. And then he or she will not be entering, at least after 2 to 3 questions, he or she would be so much confident that yes, this candidate knows about the concepts and he or she is putting it on the paper in very streamlined fashion rather than having the writing diarrhea on the piece of paper. No. And coming to the management part, again, based on the mild, moderate, and severe, starting from the termination of the exposure, gently cleaning, airway control, adequate oxygenation, use of the atropine, monitoring, the complication management, and finally, you would be also having some or other systemic manifestation management. So that if you would be writing in a very much structured template fashion, then the examiner would be forced to give you, I bet, 9 minimum out of 10 marks if it would be in the format of some structured template. Now, coming to the initial management, then the pharmacologic management. Again, pharmacologic management, two things are there: atropine, pralidoxime. There are certain endpoints of your atropine use. There are certain concern with your atropine use. Then what is the dose of the appropriate atropinization and how you are going to titrate your atropine dose. This is all about your atropine. So 4 lines, I'm able to finish my atropine concept. Now coming to the pralidoxime, what is this? When you are going to use, what is the evidence currently, when you are going to use it, and after what time you are not going to use it. If you are making it very clear on your that exam day on this your theory paper, then the examiner would be very confident of giving you full marks. if you can create, if you are an artist, you can create some or other like infographics on the piece of paper, again that would be giving some extra like the age, that yes, writing so many things and just making some or other bullet points or some or other like mnemonics, something like that. So that would be also a very impressive for the candidate for the theory exam to get good marks. Now, to summarize, I'm just giving you one example about OP poisoning. It's not that it would be always the same question that would be, or the same type of structure template would be there. But yes, if you can develop a structure template for each question, so nobody is right now going to get away those like 3-4 marks that you are missing after writing so much, so extensively on your day of examination. To summarize, read the question completely, look for the subdivisions, don't be like in haste. Once you get the paper, okay, severe acute pancreatitis, let's start it. I am right now like trying to like totally like vomit all the information that I have gathered in my last 3 years. No, look for the subdivisions, give 10 seconds of your time in thinking about how I should have this question answered on 2 pages of the theory paper. Answer to the point, use diagrams, info diagrams, scientific diagrams. It's not like you will be having artistic diagrams of creating lungs and heart and the brain, making like all those connections, making all those different colors to highlight. No, it is not needed. Maybe it would be scientifically, or like the essence of your diagram is to like explain it easily and make it crisp and impressive. So that is the whole idea of writing a theory question on your day of your examination. How do we ace an any exam? If somebody is asking, understand the format of the examination, theory exam, we all know the DRNB, how it in this way. And if you are writing 2 lines in short from each of these subdivisions, nobody is going to give you less than 9 or 10 marks. Now, our aim is accuracy and precision, and we believe that at the end of the 4 months course, you will all be on the left side rather than using so many gears